So thank you for joining us. We are going to discuss the first course and subsequent treatment today. The objectives for today's topic are first course and second course treatment definitions as given to us by our standard setters, the difference between first course and second course, and then we'll walk through some case examples. First course of treatment is described as the initial plan of treatment for the initial diagnosis of cancer. This includes any modality of treatment such as surgery, radiation therapy, systemic therapy, active surveillance, etc. First course of treatment ends when there is documentation of disease progression, recurrence, or treatment failure. First course may last a year or more. However, when there is no documentation of a treatment plan or progression, recurrence, or a treatment failure, first course of treatment ends 1 year after date of diagnosis. Next is second course treatment, also called subsequent treatment. Any treatment given after first course treatment is completed, stopped, or changed is called second course. Once the patient starts second course treatment, the patient can no longer have any first course treatment. I like to mentally draw a line in the sand of first course treatment and then second course. Occasionally, if first course treatment ends due to documented disease progression, it may be the second course or subsequent treatment that results in a cancer-free status. And then if there is no documentation available regarding a treatment plan or standard of treatment, then any treatment given after 1 year is considered subsequent. This is mentioned in the SEER program coding and staging manual. When a patient is diagnosed with an unknown primary or given treatment, but then later identified as a more specific primary, the treatment already given remains first course treatment per SEER program coding and staging manual. Even if treatment is added once the correct primary is found, this will still be subsequent treatment with the new treatment due to the change in the treatment plan. So let's talk a little bit more about subsequent treatment. If a chemotherapy agent of a different group is given after initial chemotherapy, this is considered subsequent treatment per the STOR manual under chemotherapy. If the disease progresses or the patient becomes symptomatic after physician gives active surveillance as first course, then any treatment given after that is second course. Let's look at case example number 1. Patient presented to urologist with symptoms of frequency and hesitation. The PSA was elevated. The DRE showed prostate was non-tender with no nodularity. The prostate biopsy showed adenocarcinoma with a Gleason score of 6. And shortly after, the urologist consult recommended active surveillance with a 6-month follow-up PSA, and the patient was susceptible to this plan. On a follow-up consult, the PSA level had increased, so the patient was recommended IMRT radiation therapy, and the patient received radiation 2 weeks later. Based on the case example, active surveillance will be the first course treatment, which is unique to prostate cancer cases. Active surveillance is considered a first course of treatment per prostate NCCN guidelines. Since active surveillance is the only first course of treatment and cannot be combined with any other treatment plan, the radiation treatment is the second course of treatment. Here is a case example to figure out what is first course and what is second course. 71-year-old female was diagnosed with a left gingiva squamous cell carcinoma after developing a painful oral lesion. On 1/3/21, there was a left mandibular biopsy performed. On 1/15/21, there was a segmental mandibulectomy, which showed a left gingiva primary. The staging was CC4B, CN0, CN0, CM0, stage 4B. On 3/13/21, radiation was performed to the oral cavity and left neck lymph nodes. And then on 7/16/21, chemotherapy and hormone therapy were given. 11/24/21, the patient had a radiation follow-up note that stated the patient underwent chemotherapy and radiation for recurrent neck node that was mentioned in one spot of the report and also mentioned as new mets to the left neck in another spot of the report. So as a recap, the patient received surgery, radiation, chemotherapy, and hormone therapy. Surgery was the patient's first course of treatment, with radiation, chemotherapy, and hormone therapy as the second course. Based on the radiation follow-up note, radiation, chemo, and hormone were given due to the either cancer progression or recurrence of the new met to the left. Here is our next case example. We have a 62-year-old male who was clinically diagnosed with primary refractory anemia in September of 2020. The medical oncology consult dictated that a treatment plan was discussed with dacogen, but it was deferred due to the patient's worsening neutropenia. So in November 2021, the patient's health improved and the dacogen was started. As a recap, the patient was diagnosed in September 2020 with primary refractory anemia that is a synonym to MDS with single lineage dysplasia. An initial plan of treatment was given, however, it was delayed due to the patient's health problems. In November 2021, the patient started chemo that was in the initial plan of treatment. So even though this was over 1 year after the initial date of diagnosis, this is considered first course of treatment. The initial treatment plan was not refused and there was no disease progression or recurrence. So it is a rare case that this can happen. So for our last case example, we have a 79-year-old patient who was diagnosed with a metastatic carcinoma, unknown primary. After a full course of chemotherapy was given, it was determined the cancer was a pancreaticobiliary primary with the help of more testing that came back. So chemotherapy was already given as treatment, so this remains the first course of treatment. And this wraps up our CTR Coding Break. Thank you for joining us today, and we welcome any questions.